So in this video I want to talk about some results that I have gotten with a client of mine. He was diagnosed with vestibulopatia pitalica. Vestibulopatia pitalica. That's in Spanish. Um, Basically, it's a diagnosis, a problem somewhere within the ear. There is ear damage that is affecting the balance of the individual, and so it leads to imbalance basically in walking and also dizziness. Before working with me, he would experience dizziness on the daily, and imbalance. It would just strike him on daily, maybe after he got out of the shower, maybe getting up too quick, etc. So that was an issue because due to that he hasn't been able to drive, and he and he just finds it hard to work because he is trying to move places. Climbing ladders is kind of a scary thing, etc. So if you suffer from this, then hopefully this can be helpful. And if you find this informative or you think I can help you, make sure to reach out and we can book a consultation and see how I can help you out. But I just got off a call with him today. I had 3 sessions that were done on him. My intuition was that immediately after I heard that he had problems with balance, I understood that it did have to do with the ear. After talking to him, he told me his diagnoses, and he told me that he had nerve damage, that he saw a scan, and that his the nerve between his ear and I think his eyes, something like that, it was damaged. I think it was even dead or something, burnt. So that sounded pretty fixed, very determined. He had tried medicine, he tried physical therapy, but nothing really was of much help. And so, let me see, he would get imbalanced on the daily. He told me that about 15 days ago he got hit by like a strong wave of like vertigo. So that hit him while he was just sitting down chilling. Really, it's just been a disturbance. So I gave him 3 sessions. I worked 3 sessions with him. I performed the emotion code and the body code, and I felt like, the way I thought about it, he is 50 years old, but I don't think that him being getting that kind of damage to his ear made sense. He does work in the noisy areas, basically like in construction kind of environment, and so that might have caused some damage. But what I do think I do think that it did cause damage, but I think more so that there was some emotional aspect to it. Maybe he had a trapped emotion within his ears, for example, and because that was in the way, it didn't really allow for the body to heal. So even when it did, when his ear sustained some damage, I believe that the emotion got in the way of the healing process. And then I also found some imbalances in his body, just things that like recovery interference. So there was something that was interfering with the recovery of his body. And so I performed 3 therapies on him. And on the 3rd day, he messaged me and told me that he was actually noticing a lot of changes. I waited a few days and I got on a call with him today, and he told me that he feels like he improved from like on a 7 out of 10. So his symptoms are much milder. He also said that he was experiencing a noise in his ear that made it really hard for him to watch TV, for example. So he would really have to turn the volume up to be able to hear the TV. But now, because now after the therapies, he has been able to watch TV at a lower volume. The noise has really reduced, and to the point that he doesn't hear it anymore. Um, his balance has gotten way much better. He told me how he was working somewhere, and they asked him to, basically a part of the job was to use the ladders to move up, and at first he was very scared of doing it, but after the therapy session he was able to move up and down without a problem. The fear had gone away, so that there was an emotional aspect to it. And then when it comes to the vertigo, the severity of the vertigo has also decreased, and he only experiences a very mild dizziness. He told me that his gait has improved tremendously. So not much issues with imbalance. And the thing with his specific diagnosis is that this diagnosis has it has an effect on balance. It's called vestibular agnosia. Um, Vestibular dysfunction causes dizziness and imbalance. It's a common yet poorly understood feature in patients with TBI, traumatic brain injury. Damage to the inner ear, nerve, brainstem, cerebellum, and cerebral hemispheres may all affect vestibular functioning. Hence, a multi-level assessment from reflex to perception is required. The vestibular agnosia patients show worse balance but without increased dizziness symptoms. Blah blah blah. I'm just reading an article here from PubMed on vestibular agnosia. So there you go. He was talking to me about how this specific diagnosis, it has two main symptoms, which is imbalance and dizziness. Dizziness coming from the vertigo, imbalance coming from can be seen in his walk. So he told me that he's been able to walk very well, not much issue with imbalance. So my conclusion is that the therapy appears to be effective in improving the patient's balance and reducing the symptoms of vertigo and imbalance, suggesting it might be a viable treatment for vestibular agnosia. Continued monitoring and therapy over the next 2 weeks are recommended to further assess and facilitate the healing process. So I feel like just give it a few weeks. I think his body can heal completely from this. My hope is that it will. I will give his body a few more sessions just so that he can come back at 100%. Maybe give it a little boost for healing. And then I will just be in contact with him for the next 2 weeks, waiting to see if there are any noticeable changes or complete disappearance of symptoms. That is my hope. But even right now, I am very happy with these results. He sounds like he's very happy with the results. He mentioned that he wants me to help him out with his daughter, who has some issues with her bones. So I'm curious to see how that will go, and I will talk about this in the future. Obviously, right now I'm not going to mention any names, only symptoms, etc., just to keep the client anonymous unless they want. Unless they want to share their story. So that's it for now. I will keep this updated, and yeah, I'm very happy with the results. Thank you for tuning in. I'll see you in the next video. Stay lucid. Peace.